Honorable judges and respected listeners, I, Dr. Aditya RG, am going to present a paper on study of intraoperative challenges and early surgical outcome of temporal phacoemulsification in senile cataracts, under the guidance of Dr. Mrs. Shubhangi P. Nigwekar, Professor of Ophthalmology, Rural Medical College, Loni. Established technique to deal with the very common preventable cause of blindness, that is cataract, which occurs due to the opacification of crystalline lens or its capsule. Phacoemulsification is today's most popular method worldwide due to its advantages. It is a sutureless technique, has a small, self-sealing incision, produces nil or very small astigmatism post-operatively, gives a very good post-operative surgical visual outcome, and provides early rehabilitation, compensating its higher cost. Additionally, temporal phaco gives a better visual outcome as senile cataracts are usually associated with against the rule astigmatism, and temporal incision nullifies it. The aims and objective of a study are to study the intraoperative early postoperative complications and postoperative uncorrected visual acuity and best corrected visual acuity of temporal phaco at rural hospital. We included patients undergoing phaco through temporal incision, patients between 40 to 80 years of age, patients of either gender, patients willing to give a consent, and patients willing to follow up for a minimum of 3 weeks. We excluded patients with anterior and posterior segment problems like pterygium, uveitis, glaucoma, diabetic retinopathy, hypertensive retinopathy, trauma, and high refractive errors. This is a hospital-based observational, descriptive, and longitudinal study, studied for a period of 10 months from August 19 to May 20. The sample size was 22. A written informed consent was taken from the patients to use their medical record data for the study. We recorded intraoperative events during a temporal phaco and post-op visual acuity, that is the BCVA, UCVA, along with keratometric readings and the degree of astigmatism. All the surgeries were carried out by trained surgeons, and we recorded the pre-op, intra-op, and early post-op data from the medical records of our study patients. According to the inclusion and exclusion criteria, detailed slit lamp examination findings were noted in our study patients. Type of incision, its location and measurement, and the intra-op events occurring at CCC, Hyro procedures, nucleus rotation, phacoemulsification, and IOL implantation were noted. Post-operative UCVA, BCVA, and complications were noted. According to analysis, most common intraoperative complication was bleeding, seen in 18.66%. Postoperative mild stromal corneal haze was seen in 13.62% and mild uveitis in 9.08% on postoperative day 1. 17 patients had a pre-op against the rule astigmatism. Reduction of preoperative against the rule astigmatism was seen in 68% of them. All patients had a greater or equal to 612 UCVA and a BCVA of 6.6. The site of incision in phacosurgery can be superior, superiotemporal, or temporal. For scleral incision technique, the incision is 2 mm behind the limbus. For corneal incision technique, the incision is taken just anterior to the limbus. The advantages are that there is no need of superior rectus suture, decreased chances of oculocardiac reflex, and it nullifies against the rule astigmatism. Disadvantages are there is bleeding if scleral incision taken due to thinner scleral tissue. As incision is laterally present and easily accessible to the patient, it can cause injuries, that is rubbing of the eye. In a study, we found the most common intraoperative complication was bleeding as the temporal limbal area is mesodermal in origin and is highly vascular. However, no patient had an intraoperative complication of hyphema, as intraoperative use of air was done and a thorough wash was given. Similar complications were dealt by Barquet et al. Postoperative complications like mild stromal corneal haze and mild uveitis were seen on first postoperative day. Similar complications were found by Borisio E. Mehta J. and Moreno V. et al. Out of 22 study patients, there were 17 patients who had preoperative against rule astigmatism. Reduction of preoperative against the rule astigmatism was seen in 11 patients. Similar results were seen by A. Agarwal and S. Jacob et al. As temporal incision nullifies against the rule astigmatism in senile patients, they had a good UCVA due to normalization of the astigmatism. In a study of 22 patients, 11 were males, and 4th to 8th decade was the common age group. Similar results were seen by B. Shingleton and Kober et al. To summarize, the intraoperative complication was bleeding, as seen in 18.66%. Early postoperative complication was stromal corneal haze, that is 13.62%, and mild uveitis in 9.08%. Reduction of preoperative against the rule astigmatism was seen in 68% patients. All patients had a greater or equal to 6 for uncorrected visual acuity and a best corrected visual acuity of 6.6. Hence, to conclude, temporal phaco gives a good postoperative uncorrected visual acuity in senile cataracts, as it nullifies against the rule astigmatism. The only limitation of this study was there is a small sample size. These are my few references. Thank you. I acknowledge all my senior faculty for their guidance and support.